Hi everybody. Today we're going to be talking about post-acute withdrawal syndrome. So what is that? When does it happen? So before we can talk about that, we really have to talk about what is acute withdrawal, because if we don't understand that, how can we understand post-acute withdrawal? So when we've been using substance, our bodies and our brains have to go through a period of time where we're shedding all of the toxins and we're getting rid of all of the drugs that have been in our system that have caused neurochemical differences in our brain. And that period is mainly known as acute withdrawal. So acute withdrawal can happen anywhere from like 2 hours after your last dose, either of alcohol or any kind of substance, and it can go up to about 3 to 4 weeks. So the wide frame for that would be 2 hours to 4 weeks. So within that time frame, that is considered acute withdrawal. So just a little bit of statistics. 75% of stimulant users, so that's cocaine, crack, methamphetamine, any kind of upper, they will go through post-acute withdrawals, and acute withdrawals. They'll go through both. 50% of alcohol people that use alcohol will go through acute and post-acute withdrawals. 90% of opiate users will go through acute and post-acute withdrawals. So the statistics are pretty high. So it's really, really good to know about what post-acute withdrawal is, what acute withdrawal is. So when we're thinking about the population in general, who gets addicted, right? So not everybody in the world is going to have this same reaction to drugs or alcohol as other people. So really, it's only about 10% of the population out of the whole world, 10% that will go through, will have the capacity to become addicted. Not go through anything, but have the capacity to become addicted. So 10% of the population. So that's really not that much. So what's the difference between, say, an elderly woman who goes into the hospital and she has a hip replacement, and the doctors prescribe her opiates for the first month or 6 weeks for her recovery. So she's been taking opiates for 6 weeks, and then she's given opiates to go home with. Now she will go through acute withdrawal from those opiates because her whole body and her brain have become accustomed to them. So when she stops taking them, she will go through an acute withdrawal. Does that mean that she's going to have an addiction problem? We don't know. If she's one of the 10%, maybe. If she's not one of the 10%, if she's one of the 90%, she will go on with her life and she will not have an addiction problem. So I think that's really, really important to know. Now, of these 10%, we could even categorize them a little bit differently. So, and this is very broad, right? We're just going to be broad right now. So of that 10%, about 3.5% will literally have an addiction problem, which affects their lives, and they'll be struggling with it for their whole life. It's lesser of what it could be. Another 3.5% will really, really struggle with it, and that will impact their careers. It will impact their marriages, their relationships with family, friends. They could get like a lot of liver problems or physical symptoms from their opiate or whatever their addiction is. So, and the other 3.5%, or I guess it's 3%, will be the chronic people, the people who really, really severely struggle with addiction, who might be homeless, who might be out on the streets, downtown east side. Those are the chronic people. So you can kind of figure yourself which category are you in, right? So the first category, the first 3.5%, they might be able to they have a problem with substance, but they might be able to come off substance, in their own way, without, going to a rehab center or anything. They might be able to go through their withdrawals and their post-acute withdrawals and get off drugs without any intervention. Whereas maybe the middle group, they might be the ones who end up going to treatment, who struggle with it like ongoingly, and it's really made an impact in their lives. And then the other 3% would be the chronics, who like maybe a harm reduction philosophy might be a little bit better for them. They're really struggling, and abstinence may not even be in their grasp. We don't know that. Never painting everybody with the same brush. So those are just a little bit of statistics. So I just wanted to go on to talk about the different phases. So if you think about the acute withdrawal being from like 2 hours to 4 weeks. Now, what happens after those 4 weeks? After the 4 weeks, we enter this stage called post-acute withdrawal. And our brains are literally like misfiring because they're still going back to normal. They're shedding, your body and your brain are shedding all the toxins. You're not back to like a normal state. Something called neurotransmitters, which are the chemical messengers in your brain. They can be misfiring all over the place just because you're in this healing crisis. Really, you're trying to, your brain is trying to go back to normal because it's being out of whack for however that period of time when you're using substance or alcohol. So I kind of like to categorize them into stages. So if the first stage is acute withdrawal, the next stage, say between 1 and 3 months, that would be the first stage of post-acute withdrawal. And you're pretty, you're vulnerable. You're really vulnerable. And that's why when people go to treatment and they're in residential treatment, they do well, because that first vulnerable period, they're literally in a place where they can't get drugs, and they're being supported by counselors, medical people, their peers, that kind of thing. So it really kind of pads that area, because it's such a hard time in people's lives when they're coming off drugs. So I would say from 1 month to 3 months, that's a really hard time in your post-acute phase. And you might feel like very, very angry, erratic mood swings, cravings, like a lot of cravings, like you just want to use. And it's a very tough, vulnerable time. Whereas the next stage, from, so say maybe 3 months to 6 months, it's a little lessened. You're still going to have cravings. You're still going to have feelings like, lethargy, like not having any energy, the mood swings, trying to think is really difficult sometimes, and learning can be difficult, like taking information in and keeping it in, that can be really, really difficult. So, but it's a little less than the first 3 months, right? You're kind of out of that real bad woods and you're into the kind of next stage, but it's still pretty bad. And so then the next stage would be 6 to 12 months, really, so half a year. Now, one thing that I've noticed, I don't really have any research to back it up, but just in dealing with addictions and seeing how people go through their recoveries, it seems to be between 5 and 7 months is a really, really hot spot for people relapsing. So you can wonder what's happening. People, they're starting to feel better. They're starting to figure out that, I feel healthier. My brain is starting to, I'm out of the woods. Maybe I can drink or use drugs again. Maybe I'm better and I can handle it this time. So just to be aware that 5 to 7 month period is very, very vulnerable for relapse. So you can, just, I think if you're aware of it, you've got more of a chance of getting through it. So between 6 and 12 months, you're really starting to feel better. You still might have lots of tiredness and everything, but you can see that things are getting better and you're feeling better and you're getting cravings still, but they're more widespread. Like you're not having them every day or every third day or anything. You're kind of like, oh, you might have one in 1 week, and then 2 weeks later you might have another craving or something. So they're further and fewer in between. And then when you hit the year mark, you're really starting to feel good, right? And it's like your brain's starting to work better. You're feeling very hopeful in your recovery, and you might be having cravings every once in a while. You know, it could be like every 2 months you're having cravings. Some people don't even get cravings, but just to be aware that you're still, you could still have the mood swings and everything, but it's really starting to stretch out. Then when you get to the 2-year mark, you've literally regrown all of the neurons and everything in your brain. So this is where you can say that my post-acute withdrawal stage is over at the 2-year mark, and you're kind of out of the woods, and you're literally like finished with all of this stuff that goes along with addiction. So I wanted to go a little further into what post-acute withdrawal and what the acute withdrawal looks like. So before we begin, I just wanted to talk a little bit about neurotransmitters. So neurotransmitters are chemical messengers in the brain. So they jive with our neurons, which are the electrical system of our brain, and carry the message across our neurons. So what happens what happens when we're taking drugs or alcohol is that we're manipulating our neurotransmitters in our brain, and that's what gives us the high. So the high is not particularly from the drug or the alcohol. The high is from how that drug or alcohol has affected the levels of neurotransmitters in our brain. So for example, let's talk about alcohol. We'll just start with alcohol. So with alcohol, the main neurotransmitter that's being affected is GABA. Now GABA, I'm going to read it because it's a long name. Gamma aminobutyric acid. That's the name of this neurotransmitter. And this is an inhibitory neurotransmitter, which means that it has a depressing or a down, like calming effect on the brain, on the central nervous system. Could be on the body as well. So what happens is that when you take alcohol, you get and there's a lot of GABA that's affected. GABA is like all globally around the brain in the neurotransmitters. So when you take alcohol, you get this global depressing effect, which is calming. It feels like it's soothing. It feels like liquid courage, like you're not inhibited anymore for speaking or doing things. So it's really important to know that when we are taking alcohol, and we've taken it like so much that we're addicted to it now, and we're going to stop taking it, what happens is that our GABA neurotransmitter is going to be at low levels because we've been manipulating it for so long. So what can happen is that we get the opposite effect in our what happens to us during the withdrawal, the acute withdrawal, and we get shaky. Right? So we're no longer calmed anymore, we're starting to shake. So anxiety, panic, the shakes, and at the worst, we can have seizures. And that's what happens. Like a lot of times people aren't even, they don't realize how addicted they are or how much they've been drinking, and they don't realize that they're at risk of seizures. So it's really important to let your doctor know, like if you're not going to be going into like a treatment center and being withdrawn medically, or into like a detox unit where they're going to watch you and take care of you and give you medication for your withdrawals. It's really important that you go to your doctor and you say, I've been drinking a lot, I'm going to stop drinking, and maybe the doctor can give you some. Usually what they prescribe are benzodiazepines, and benzodiazepines calm the nervous system so that your brain, your electrical activity is not at the risk of seizures. So it's really important that you communicate that with your doctor if you're not going to be medically monitored or in a detox unit or that sort of thing. So what kind of things do we see with alcohol withdrawal? I think it's really important to talk about that, because what happens is that, you know, they can get the shakes really bad. They a lot of the times they don't realize, and this is for all substance use or alcohol, but especially alcohol, the B vitamins in the body are completely diminished, especially B1, which is thiamine. And it's really important to realize that because of the addiction, that you're probably really low on a lot of vitamins. So especially for alcohol, that can be the B vitamins, and thiamine is like a number one for alcohol. So some of the symptoms for acute withdrawal are just the shakes, really, really bad shakes, incredible cravings. People that are coming off alcohol have incredible cravings, and the seizures. And a lot of people, they want to sleep, but they can't sleep, so they're very restless, and they can't eat. A lot of people coming off alcohol get diarrhea and unable to stomach any foods. There could be some vomiting there as well. So those are kind of the main ones for alcohol. Sometimes if your liver's really, really compromised, you could go jaundiced, where the bilirubin from the liver is at very high levels, and it's showing through the skin. So you could get the yellow eyes, and you can get the yellow skin. And that means that your liver is compromised. And sometimes you get pancreas problems as well, and you could have diabetic symptoms, so high blood sugars and high liver enzymes. And it's really, really important to keep monitoring that with your medical practitioner, because when you're at that compromised state, you know, you could run into trouble, right, health-wise. So I would really recommend partnering up with a medical practitioner so that all of these physical things can be monitored, especially the liver, because a lot of alcoholics, like, they get like the ascites, where their belly gets all swollen. And yeah, now we're going to be talking about acute opiate withdrawal. So acute opiate withdrawal is quite really important. There's an opiate crisis right now. There is a lot of people who are overdosing, who are dying, and a lot of people are not getting the right help in order to get off. If they want to get off the drugs, they're just, it's a really huge problem. So I wanted to spend some time on going through the acute withdrawal for the opiates. So opiates would be fentanyl, heroin, any kind of codeine or oxycodone or morphine or any type of opiate painkiller, and they affect the endorphin neurotransmitters. So what the endorphins do is they relieve pain. So there's this sensation in the body where there's no pain, feeling euphoric, feeling good. A lot of people describe it as a nice warm blanket or a hug. So when we're coming off opiates, it's really felt in somatically in the body a lot. And that's why now, because of what's going on, opiate replacement is really preferred. It's not preferred for people to go cold turkey and just stop taking them. It's preferred for people to go on opiate replacement, at least for 1 to 2 years. And I know a lot of people, it's very controversial that if they want to get off drugs, they don't want to take any drugs, but this is like a safety precaution, because when we are coming off the opiates and if we were to relapse, say we haven't taken opiates in 3-4 days or a week or 6 weeks, it means our tolerance has dropped like significantly. And what happens is that if we take the opiate, if we relapse, we get a craving and we fall back into it, we have a very high chance of overdosing and dying, especially if we're not doing it with somebody, if we're doing it alone, right? If you're locked in the bathroom and nobody's there and you're hiding it from people, there's a very, very high chance of death, of overdosing and dying. So opiate replacement is really, really pushed these days. So like I said, it's endorphins that are being manipulated in the brain. So when we go into withdrawal, we can get a lot of pain. A lot of people say they have really, really bad back pain. Their legs are aching, their joints are aching. They just feel like everything is like crumbling up, like in their body. There's very, very bad. People get very, very bad diarrhea, vomiting, a lot of the nose runs, because the opiates, when you're taking the opiates, they affect the mucus. It dries up the body's mucus. So the opposite effect happens when we're not taking the drug anymore. So it could be crying eyes, crying like nasal mucus, runny nose, that kind of thing, diarrhea, vomiting, like all the water in the body starts to move, right? A lot of diarrhea and cramping. People get restless leg syndrome really, really bad, where they just can't stop moving. Their nervous system is all out of whack and they can't stop moving. Feeling like the worst flu symptoms that you could imagine. Really, really not feeling well, not being able to get off the couch, no energy, lethargy, feeling sick, that kind of thing. You can get temperature control, where you get the feelings of being too hot, and then all of a sudden you're sweating, and then getting the chills. So it's the cold sweats kind of thing. Your temperature regulation is affected. Sometimes people get this weird swallowing thing where they can't stop swallowing. It's like this hyper reflexive thing, and that can happen with like throwing up as well, like always wanting to throw up, or gagging kind of thing, or it can be in the swallowing. The withdrawal symptoms are really, really nasty. So methadone is one of the drugs of treatment, or Suboxone, or the other word for Suboxone is buprenorphine. And these two drugs will literally halt the withdrawal symptoms. They are opiate replacement, and so that your body will not go through the physical withdrawals, and it will keep your tolerance at a level so that if you did relapse, you wouldn't end up overdosing, because you were still being maintained at a certain level of opiate. So some people think, oh, I don't want to do that, I don't want to go, I want to get off the drugs, why would I go on any other drugs? And that's a valid point, right? When we do want to get off drugs, we want to get off, and we don't want to like go on to something that's going to go on for a long time. And the thing is that when we're coming off opiates especially, it's slow and steady wins the race, right? It's not like the cravings can be so severe, and the relapse can be so high. People relapse like a lot, that the replacement just getting your physical symptoms settled down so that you can start working on any kind of psychological issues, getting a job, going back to school, getting your life in order, starting to heal your relationships. And an opiate replacement enables this to happen. And most doctors would like people to stay on at least 1 to 2 years of opiate replacement, whether it be methadone or buprenorphine. It doesn't really matter which of the opiate replacement that you take. And you know, you don't have to go on a high dose. You know, you go on a dose that's good for you and that you're not feeling any withdrawal symptoms anymore. I think sometimes we have expectations of ourselves, and we can do ourselves more harm than good. So just knowing that this is a part of the healing process. This is part of, you know, going on opiate replacement is a valid and medically preferred way of getting off opiates long term. So, and you can literally, like, once you're on and you're stabilized and your life is getting better, you can start weaning yourself off, with medically monitored, of course. No doctor is gonna, you know, say, oh no, you have to stay on a high dose. They're gonna, if you want to start coming down, you can just start coming down so that you're not feeling it. You don't want to feel withdrawal symptoms. And once you get low enough, you can come off it. You make sure that you have the right supports in your life that will you know, support you while you're coming off the opiates. So yeah, that's one thing about opiates. And we're going to stop here, and we're going to come back in the next video to talk about